Roshan. Thank you for joining us. Roshan here has joined us today from Bangalore. Thank you for taking your time to spend with us. We have a huge segment of patients who have problems with musculoskeletal disorders. Most of the musculoskeletal disorders are related to arthritis, be it seronegative rheumatoid arthritis, sometimes it's seropositive rheumatoid arthritis, and then age-related degenerative osteoarthritis.
Yes.
And I understand you, as a functional nutritional practitioner, having qualified from the Institute of Functional Nutrition in USA, are doing a lot of good work in these kind of cases using probiotics. Can you tell us a bit more about that?
Yes, Dr. Karthik. Thank you for calling me here and having a discussion on these various probiotics and things which can help in many chronic cases. So specific to this specific case of autoimmune, where there can be joint or inflammation in the arteries or supply of the blood itself. When we see such patients, we of course see that some of the inflammatory markers are high. Like the most major one we see like CRP, ESR, but they are much more like the cytokines profile. And then the probiotic, how we use there, again we see a WBC first. If there is an autoimmune condition with more WBC, and what is the primary reason for the WBC to be high, and if it is a lower, so we have to work with a right kind of probiotics for such cases. There can be cases where they have a mast cell issue, which is an immune hyperactivation. Then we have to start with some probiotics which does not cause more histamine. Like a histamine is a chemical compound. If too much of that can create a lot of allergies and there can be a lot of immune kind of related symptoms.
So you're saying that in patients with already high mast cell levels, you don't want to use probiotics which aggravates their condition.
Yes, which does not add to the histamine productions. Because this histamine, the most important thing is the connection with the DAO, the dioxidase enzyme, which is produced in the gut and by the brush border. So the bacteria are responsible to produce more DAO, so that it can expel the excess of histamine. So if the bacteria are not there in the right quantity and the right potency, then the histamine can be too much in the body, and that can aggravate the symptoms. There can be pain, there can be immune kind of activation. So we use certain probiotics for those cases which is antihistamine in nature. Like for example, L-Gaceri, Plantarum, Rhamnosus GG, Saccharomyces boulardii if they don't have yeast allergy. So we start with those, and then there are categories of probiotics which can help in this joint or actually addressing the root cause. Because if you use a like in a other approach, if you use certain things which everything works on the kind of an anti-inflammatory agent to improve, like IL-10 for example. So how does a probiotic work? They produce something called bacterins, and they are also an anti-inflammatory agent. So we use certain probiotics, and there are a lot of research. If you search as a clinical research, some of the spore-based bacteria like B. coagulans, and there's a special strain. It's a company called DigestiveHealth, and they have a GB3086 is a strain number.
Okay.
And they help to reduce the interleukins, the CRP, and then we use other combinational bacteria like L. reuteri, L-Gaceri, Plantarum, and Rhamnosus GG as a combined kind of either to have a product or to ferment those specific microbes at home in form of milk, dairy fermentation like yogurt.
Okay.
Or it could be like in non-dairy like coconut yogurt or any other nut milk, or it can be some juice fermentation like pineapple, mango, based on seasonal fruits.
So we can either use them as the nutraceutical supplementation itself, or we can actually ferment these products at home to get these kind of strains of bacteria, what you're talking about.
Yes, the only difference is if you are looking for quick results and some rapid relief, so we are going to monitor anyway the inflammatory markers. So we suggest to use this yogurt form because they have more billions of bacteria. Nutraceuticals, you will get some billions, with 10, 50, 100. And sometimes for those chronic cases, we need more billions, like 400, 500. They are possible to get through the nutraceutical, but it can be very expensive. And you have to take for at least like 8 to 10 weeks. So here the yogurt things are very beneficial because this can have more microbes. Like half cup of the yogurt can have like something around 200 to 50 billions of, and it's easy to take. It can be re-fermented as it can continue to be fermented as long the patient want that. More advantage of this kind of yogurt is we're adding a prebiotic fiber as a recipe, and that helps to grow the bacteria. And this is fermented longer as not as a traditional yogurt. So traditional yogurts are usually overnight, like we put in the night and it's ready by morning. This is specially done for a specific timing, like 36 hours to 40 hours, so that the bacteria are at the highest potency and the bacterial count. So someone do a flow symmetry test every hour. If they check, they will know that 36 to 40 hours gives the maximum number of bacteria per measurement.
So are these probiotics, do they vary in other chronic conditions? For example, if you're talking about, say, psoriatic patients,
Okay.
is it the same probiotics you're using, or is it a different group of probiotics what you're using?
So any inflammatory disorder or autoimmune disorder will have to work on the working on the immune system. Like most of the immune disorder comes from the gut, the mucosa layer, and the mucosa layer damage happens when there is no right bacteria and the right amount of short chain fatty acid, which is the byproduct of all the bacteria. So some of the bacteria, which is a lot of research are there, we will keep it same. Like for example, L. plantarum 299V. This is a special strain which helps in a lot of conditions. It works for autoimmune conditions. It works to remove the heavy metals, like it can bind with heavy metals. It can work to improve sleep. Sleep is the most important component when we want to work on healing. So any bacteria which improves sleep, reduces pain, and like as you said regarding the bone disorder or joint disorder, we also want to improve collagen. So some of the bacteria will be chosen based on which can help in the collagen productions. Some microbes we choose which helps in more production of vitamin B, vitamin K2. So these are made by the bacteria. So we will keep at least 2-3 kinds of similar thing, because the autoimmune nature is inflammation, and then we try to add what the person need, whether the person need to address sleep, whether the person has a constipation, and the person has less weight. Some people can be like underweight and they want to build on the muscle mass and the bone density. So we'll choose based on the different symptoms and conditions.
So a patient coming in with, say, an autoimmune profile, usually with raised inflammatory markers, has a group of set probiotics which you can use to reduce the inflammatory markers, the cytokine levels, thereby improving their health.
Yeah, so some of those are like Rhamnosus GG. We use Lactobacillus casei. There's a specific strain called BNR17. We use B. coagulans, as I mentioned, GB3086, which is a very good spore-based. A lot of research to reduce the CRP and ESR. We use this L-Rotri to boost oxytocin, so which helps in reducing pain. Because it works in central nervous system, it improves sleep. So these are some of the common ones. Then suppose a person has a high GGT number. Okay. Most of the autoimmune disorder, we see the liver enzymes are elevated, either because of they are on some of the NSAID or because of the effect of the oxidative damage. So we will try to boost the glutathione through the microbial fermentation. Okay. So there's a bacteria called L-fermentum, which helps to boost the glutathione. So we add that also in a yogurt. And sometimes we want to make their life easy, so we try to co-ferment them. So if I ferment separately each of them, I might get 200 billions every half cup. Okay. But if I co-ferment together, it might be like 70 billion per microbes. But it's still better than the commercial probiotic, because this you can save cost and you get more microbial count. It's a live bacteria close to the food. So this has more advantage. And there was one point here, when we do co-ferment, it's like the garden, like when we grow too many vegetables, we don't get everything. Yes. Some are more, some are less. So it's the same concept work here. So this bacteria, again, we are boosting certain microbes, but there is a kind of a harmony inside. So they will boost certain other microbes. Okay. So some of the microbes are
beneficial microbes. They will
boost all beneficial microbes. Okay. Yes. So what happens, like for example, Akkermansia. Akkermansia, if you have a little bit of Akkermansia, we can easily boost through some prebiotic fiber like pomegranate, polyphenols, capsaicin, fructopolysaccharide, which is another fiber. So similarly, and the fusobacterium depends on the Akkermansia. Fusobacterium depends on other steam work. So it's basically a teamwork, not just boosting one strain and to have the effect.
Okay.
So we are choosing certain strains to help with the symptoms and improving the blood markers.
Okay.
At the same time, we are also supplying the nutrient required for this bacteria to grow more, like prebiotic fibers. And then with all this thing as a synergy, they will work as a team, and they know how to take care and create that balance what the person needs.
So you're actually giving the entire, you're making the ecosystem conducive for them to grow in their own terms as well by giving
Yes.
prebiotic fibers.
Yes, and there's even if you go too deeper in science research, no one had that conclusive data like, okay, this bacteria can lead to this bacteria's formation. There's always emerging, like based on the condition which is unique to that person. So it depends on other markers as well. But what is important for the anti-inflammatory or the autoimmune condition is to boost the butyrate production.
Okay.
To choose the bacteria which produces more of the butyrate, which is the short chain fatty acids, so acetate, propionate, butyrate. They help to repair the mucosa layer. Once the mucosal layer is damage is repaired, which takes some months, then what happens? The immune reactions to damage our own body reduces because that activation happens when the toxins goes into the bloodstream. So what toxin we are talking is the lipopolysaccharide LPS, which is the byproduct of the bacteria, the biofilm destruction. So every LPS, if it is too much, and then if it is going into the because of the low mucosal strength, then it can activate the immune to be more hyper vigilant. Then it can attack whatever it comes on this way. It can be the hair, which is alopecia areata. It can be skin pigmentation, like melanocyte, which can be vitiligo. If it works on the joint, it becomes arthritic and other things. If it works on skin, as other condition can be psoriasis. So all has a common. Even on the myelin C, the nerve damage, we see like pigmentosa and there are like a lot of diseases related to the eye damage also, which is related to the nerve damage. So
all of these are because of the lipopolysaccharide,
Yes.
which is the cause of all these things, which are.
Yes, doctor. And lipopolysaccharide, I mean, there are some lab can measure it. So there was some bacteria like probiotic company, they were doing some research. So this company is called Biotic Quest, is a US company who developed a lot of therapeutic probiotic. So they were giving this this probiotic, and they were measuring the lipopolysaccharide before giving this probiotic, and every 4 weeks they check the lipopolysaccharide.
Right. Okay.
And they see there is a huge decrease in the number. And then they had some special, probably in internal lab, which they are measuring the LPS.
The LPS. Okay.
I mean, we cannot test every time all the various detailed testing. The most basics ones are CRP, the CBC panel, the liver panel. Sometimes we see the uric acid. Sometimes we see the homocysteine also.
Yeah. So there are surrogate markers. Instead of looking for LPS, we can look for homocysteine and things like that.
Yes.
HSCRP or homocysteine.
HSCRP, homocysteine. Thyroid antibodies have a strong connection with all autoimmune conditions.
Okay.
Even if the antibodies is just slightly up. Like if you see the range in the blood chemistry, it is like they say less than 28, less than 60. But in the functional approach, we see when it is more than 1 is the problem. So we have a different range to interpret, like functional medicine or functional has it like we want to bring everything to optimal markers. So we see that differentiation, and we see symptoms all there. We see even if the CRP is still not elevated, the person is still having the symptoms. So we'll have to work on first to address the autoimmunity, which we have to work on the gut mucosa. Even the thyroid disorder like Hashimoto, people try to go and work taking T4, T3, a lot of nutrition supplements like boosting selenium, iodine, like tyrosine. I mean, those can help to produce more thyroid, T4 hormone, or convert into T3 hormone, support liver. But actually, we are not looking the gut part.
Primarily, it has to start at fixing the leaky gut and the
Leaky gut. Yes, doctor.
The other related issues. Anything else you could suggest to fix the leaky gut apart from what we are already doing?
So whenever we do the probiotics, again we know this is combination of things. So probiotic can help you to restore the right microbe and then build the team and things to work. But same time, we also have to see that person need any digestive support. Whether the person has a lot of gas bloating or unable to break down the protein, because any food, if you're not broken down, it is also being converted into some form of inflammation. Because those food will be fed by those bacteria and the different places in the gastrointestinal tract, and the bad microbial can grow more, and that can create more imbalance. Like it can affect the digestive system as well. But most important I see in autoimmune is to work on how do we repair the mucosa. Restoring the microbial count will help in reducing inflammation.
Yes.
But repair part is also very important. So we use a combination of herbs like okra extract, marshmallow, aloe vera extract, slippery elm, DGL, the glycerized licorice. And some cases we use the glutamine. Some cases we use the pectin. So it's a combination of products. So you get a lot of companies who build this kind of GI repair, GI revive. So they help to build the mucus layer. In any autoimmune condition, we do this at least 3 to 6 months.
Okay.
And start slow again. Like start at half scoop, increase to 1 scoop. And some people say, I don't want to take this. Then we ask them to make their own concoction.
Okay.
So buy the separate products like marshmallow, slippery, and clove is also a very effective to build the mucus layer, which has a eugenol, has a property. So we use this combination of herbs, and then we at least do 3 to 6 months. And anyway, we are measuring their symptoms, we are measuring the blood markers every 4 to 6 weeks, which we also do conventionally anyway. So that will give a lot of kind of, the patient can, like they can see that they are in the right direction, and then that motivation can help them to continue further. And this yogurt and things, what we do by teaching fermentation, which is like art of fermentation, they can do this lifelong.
Okay.
They can prevent things to happen later. They can same thing can help their family members not to get the same disease because of the genetic reason. Like if my mom had arthritis, I started doing this early as possible so that I don't go into the same path. She had a vasculitis, which is Takaisu, which is the immune system attacking the arteries. So you have an aneurysm, several aneurysms, and the high chances to. So when I started all this thing, she had a kind of a huge subclavian aneurysm, and it was like impossible to do open surgery there. And then she was on biological drug and so many things. Those helped her to calm down the immune system and maintain the numbers. But what is the long-term solution? So I have to add all these dietary changes and functional nutrition and the probiotics and some supplements to help on the long term, so that I can use conventional where it says a rapid immediate need and help her, and then long term to do with the nutritional and something more feasible at home. And then she has CRP and all. When slowly those medication was descaled, we are still able to maintain the same low numbers with this probiotics. And some probiotics we don't have to take daily. Like you need to refill like few days in a week. I mean, most of the bacteria stay in the gut for 2 or 3 weeks because these are not colonized. This is not like what we got during the childhood. We missed that like period. So, but they can still help. I mean,
one of the things what we see commonly is the young people who are in the IT industry, who have not so good eating habits, and they have not so good sleeping habits. They sleep late because of their work. They eat late, they eat the wrong food, and they end up having a lot of problems with their stomach. Be it constipation, be it reflex. Reflex. Sometimes it gets mistreated as high acidity, whereas in fact it is the sometimes low acidity, which causes low acid levels, which is preventing the breakdown of the food and thereby giving rise to bloating and other symptoms. Now, what is your suggestions to this group of young people? Young, they're actually fairly young, no less than their 30s, maybe early 30s, but they have completely misunderstanding of the time of the food habits and their lifestyle habits.
Yeah, I was gone through that path, so I know very well. So I used to have a lot of reflux, and taking Digene and things were not giving me any kind of long-term solutions. So for those cases, there are few things very important to have some kind of like a hygiene principles, like when you do multitasking and you're not chewing your food, you are missing the enzyme productions. And when you miss the enzyme production, your stomach has to work more to produce more stomach acid. And then if it keeps happening, then there is a way that the stomach acid can stop producing more acid. And because of the low stomach acid, there is a less of the food breakdown, which lead to more of the feeding the microbes in the small intestine, and then the gas production can be high and acid reflux and thing, which can damage esophagus if they have more bacterial thing. So chewing and oral hygiene is very important to maintain even in the busy schedule, and at least if you cannot have every meals, then at least try to start with one meal a day. And then work on adding more of the anti-inflammatory food, because we see a lot of time in the IT industry they package food.
Yes.
And then they carry a lot of cookies and stuff, a lot of overuse of coffees and tea, and sometimes they don't have time, so mostly like bread and stuff. So more of the refined stuff and lack of fiber. So if they have some hygiene principle and some nutritional component in their diet, and even if they follow a rule like 80-20 rule, where 80% I try to be eating something healthy and 20% I'm okay to go haywire and things. So that can really help to bring down all the symptoms. And many times we see that if it is a very long-term thing, like they had this happening for many years, and sometimes we see they can have a H. pylori infection because of the travel and things, and they have low stomach acid. Because we usually check the gastrin level, and sometimes the H. pylori itself can tell. So those can be a problem. Then they sometimes in early age they need the support of stomach acid, like apple cider vinegar or betaine or some enzyme production. But that is a short-term thing.
Yes.
Then we have to work on the probiotics to address the SIBO, the small intestinal bacterial overgrowth, which is not happening just one day. It's because of habit. It's because of lack of sleep, which disrupt your microbiome. It's like lack of physical activity, which again disrupt your microbiome. Lack of the choice of fiber in the diet, so basically eating no raw food, and stress, mental stress, and the pressure to complete the work, and always report to your higher authority, and those things create a lot of mental stress. So they are always on the high cortisol. So that affects the sleep. So fixing all these things, managing stress properly, and having
so in order to actually correct your SIBO, you have to go back to the basics of eating fiber, sleeping properly, managing stress. All those kind of things will then help fix your SIBO.
Yes, doctor. So you are gonna go to the basics, so that even if you correct your SIBO, it doesn't have relapse. Like we have many cases in SIBO, even if you use high herbal antimicrobials or even probiotic approach, we usually do two approach. And then we use the high density of the combinational probiotics to address the SIBO, whether it's a methane based or hydrogen or hydrogen sulfide, or we use a certain herbs as a specific dose for a period of 6 to 8 weeks. And during this phase, they have to eliminate certain food, and then we have to work on the restoration and repair. So this whole thing can only be fixed permanently when they change their lifestyle.
Yes.
Otherwise, 2 months they're okay. Even if they take Reflexmine, they feel much better.
Yes.
But after two months, what happens?
Yes.
It comes back again.
Even Reflexmine, sometimes you have to give for longer periods of time, and it doesn't have the desired effect. Once it goes, sometimes the second time you give it, it's not having the desired effect.
Yes, because body got used to, and again we have a dose limitation, in terms of the protocol wise. So for herbal also I use a combination of oregano, berberine, allicin, which is an active extract of garlic, which when you chop the garlic, it only stays in the air for 5 seconds. So that allicin is stabilized form. We use a high dose. Again, we try to address multiple things, not just like hydrogen or just methane. Methane is more used for the constipation case. Someone having a kind of a diarrhea symptoms, we also target the hydrogen sulfide, where we use certain specific product like UAC or silver hydrosol. And hydrogen is berberine usually works best. And then sometimes some essential oil combination also. Neem is a very good effective for fungal and hydrogen dominance, and even hydrogen sulfide as well.
Okay.
So we use this kind of a therapeutic dose for, and then most important thing, even any protocol, even someone do a stool test, detailed stool test to know what microbes they have. we must shake the mucosa layer a little bit.
Okay.
So that this bacteria can little bit pulled out, and we can see more visible in the stool test. So same when we are doing this phase of cleaning, if I don't break down the biofilm, because that's like a calcium layer, a strong layer. So to breaking the biofilm, we use something like NAC, the N-acetylcysteine. We use a high dose of vitamin C. Allicin also breaks down the biofilm. So we always combine allicin if the patient can afford that kind of combination thing. So the natural biofilms are always good. Allicin doesn't destroy any bad, good microbes. It always works on the bad stuff. And as a high dose, very safe for pregnancy, very safe for old people, and even for the IT sector. So if protocol is needed, then we need to do that, because until we clean the soil, we can't fertilize it. So we need to, and then we work on the restoration, then we work on the repair, and then we don't. Sometimes we have to repeat this process back. Yeah.
And how often, when you say repeat, when they should come,
so if they suppose when during the protocol they saw suppose 70% improvement, this I'm saying from a kind of a chronic cases, and then another 3 months of doing repair and restoration, they have seen another 20% improvement.
Okay.
And then all of a sudden they have stopped everything.
Okay.
They have gone back to their old habits.
Okay.
And they catch one infection or food poisoning, and all come back. So if you try to maintain, rebalance is very important, which is the 5-hour or 6-hour, whatever people follow. So 5-hour is basically the last one, is the rebalance, where we have to keep adding this good stuff, the fiber, the probiotic, the sleep, the stress management, and the physical movement. But the last one, which is something called repeat, which is only needed on some cases where they have more chronic cases, like where they have been suffering from 10 years, 15 years. So those cases sometimes we repeat, like we do a candida cleansing. Candida cleansing is usually done like 15 days.
Okay.
So we try to repeat 2-3 times in a gap of at least 20 days. Same for parasites. We plan a parasite cleansing before full moon day.
Okay.
So the protocol usually is like 3 plus 3 days before full moon, 3 days after full moon. This is for people who is very sensitive.
Okay.
Then if they are strong enough, we choose 10 days or 15 days. So different from different case. Again, 3 days we use for children and something like that.
And your parasite cleanse and candida cleanse, what do they contain? Is it your normal allopathic medicines or herbals or nutraceuticals?
So we use herbals. It's a combination of herb, like parasite we use like wormwood and some of the essential oil based things they have. But when allicin is very effective, and we also add the microbes during the same time of cleansing, so that it support the immune system, the mast cell. So it helps in elimination of parasite if the immune system is well supported. So we use Saccharomyces boulardii, which is any antibody cannot kill it. It's like a very strong resistant. Even during the antibiotic course, even a lot of doctors suggest Saccharomyces boulardii to be taken. So that is suggested, and Ramacin GG. These two things to boost your immune system. So that then this process of, sometimes it's not that someone comes to us and we just immediately start this cleansing. We have to see the blood markers. We need to see how the detox pathway is working, how is the liver enzymes. If the liver or bile has issues, then the toxins can recirculate back.
Yes.
So we have to see that thing. We have to see homocysteine. If homocysteine is too high elevated, like usually we see at least 20 and above in most of the cases. So we need to correct that so that when they do this kind of cleansing, it works well.
And they don't eliminate it rather than just recirculating.
Recirculation, and also they don't get too much die-off reactions. We prepare their body beforehand to handle this thing. And we also explain them, you may get some symptoms, which can be diarrhea, low energy, which can be nausea, which can be vomiting, but that will be momentary. So protocols usually are like the SIBO and other things. C4, if you do, we do 6 to 8 weeks of protocol. But we see 4 weeks. And first 2 or 3 weeks are very tough.
Okay.
Because they have to take so many pills, there's a timing to be followed, and they have to add binders to absorb the toxin, which is charcoal or any combination of binders we use. And binder has to be separated from food and supplements, so that becomes a challenge for IT people. So we try to adjust, as per their convenience. So morning and evening dose rather than 3-4 dose. And sometimes we try to, in the first 2 weeks, we try to slow down the recommendation. So not too many capsules and things. Start slow, build that resilience, and then build up on the right amount of therapeutic dose required.
Good. Excellent. Thank you so much for sharing all this information with us. Is there anything else you would like to add?
So I would suggest that the best is like first you have to improve your blood markers. The blood markers which you see, doctor. We don't want to stay just normal. When you want to be efficient in everywhere, why just stay normal in the blood markers? So you know the range. Try to be on the functional level what your body is trying to operate, so that then you can prevent so many things to happen. So that's the first step. If you don't understand, book a consultation with any of the functional nutritionist or functional medicine practitioners who can help you to understand that. There are a lot of good books you can learn on your own, like CBC, blood chemistry by Dr. Deacon Witherby. So there are so many things available online. So blood chemistry, because symptoms sometimes can be overlapping. Symptoms can be like, I have this symptom, but I can have multiple things symptom. Of course, you need to go to the doctor to do the right diagnosis. And some additional test might be sometimes needed. If someone having very chronic cases, then we do a detailed test of the stool analysis and all. So basics, what we discussed in the beginning, the primary basics are very important. Improve your sleep. Have the circadian rhythm. If you think it's not optimized, see how we can improve that first. Because the sleep is not in the right place, you will be like angry next day, anxious and irritable. So those can create so much of imbalances. So that is sleep is the most important. Physical movement. If someone is not motivated enough, see what you can do. You can do swimming. You can do just walk. You can just avoid lift. You can park your car far and walk. And what you can do for a little bit on the physical movement is to start with. And then someone is already physically active, then see how you can work more on their resistance and the bone density and stuff. So sleep and then bowel movement you monitor every day. That is the best thing to know your health. The Bristol chart you find online, you Google it. You'll find that what is the stool type, whether you have fat floating, whether there's color of the stool, texture, everything can talk about your health on the daily basis. So that's like an optimal tracking document kind of thing, like you're tracking your health through your bowel movement. That's the most important. And then if you're feeling sleepiness during the daytime, which you should not be, then check again detailing insulin resistance, rule out those things. And diet-wise, follow what rule best, whether 80-20 rule or 90-10 rule, and then at least try to work on more on the anti-inflammatory food, microbiome, and the prebiotics are most important. We all have got depleted because of so much infection in the past, so much antibiotic use. So antibiotic use is not a bad thing when it's needed, is necessary, but we need to also restore them back, the good microbes. So I think they keep the basics right. And if they have problems, try to analyze more on the optimal range, improve them, monitor it. Not like just do one time and leave it like that. This is your health.
Yes.
This is your body. If we don't take care of ourselves, then this is the one we are going to suffer later.
Excellent. Thank you very much for your time, Roshan.
Thank you, Dr.
It's been a very informative session, and we shall do these kind of sessions, and we'll come back to you at a later date for more sessions like this.
Thank you so much, Dr. Karthiki, for inviting me here.
Thank you.
Thank you very much. Thank you.